Good evening, guys. Now, tonight's discussion D, the title is Caring for an Aging U.S. Population. The good news and the bad news signals dual narrative. On one hand, genuine process in medicine, housing, technology is reshaping what it means to grow old in America. On the other hand, the sheer scale of demographic change, financial pressures, and workforce shortages threatens to overwhelm families and public systems. The surrounding article situates aging as both a triumph of longevity and a looming challenge of healthcare, social policy, and community life. The good news: medical and technical medical and technological process breakthroughs in joint replacement, cardiac inventions, and emerging Alzheimer's therapies promise longer functional independence. Preventative care and chronic disease management are improving, allowing many older adults to live healthier lives for longer. Home-based supports and smart home tech, remote monitoring, telehealth, and smart home devices are reducing isolation and enhance safety programs like capable, which stands for community aging in place, advancing better living for elders, combine nursing home, occupational therapy, and handyman service to help seniors remain at home. Senior villages and community cooperatives provide social connection and practical support. New housing models, the greenhouse project, and other small scale community style nursing homes emphasize dignity and autonomy. Multi-generational housing and home sharing arrangements are expanding, reflecting cultural shifts toward family-centered care. Even traditional nursing homes are experimenting with redesigns that prioritize comfort and personalization. Policy experimentation. Medicare Advantage plans are beginning to cover non-medical support such as transportation, meal delivery, signaling recognition that social detriments of health are critical to aging well. The bad news: demographic surge. By 2054, nearly 1 in 4 Americans will be over 65, and the number of centenarians is projected to quadruple. This this unprecedented shift will strain every aspect of the health and social care system. Escalating cost. Long-term care is financially daunting. Current national averages exceed 116,000 annually for a private nursing home room, while home health aides cost around 75,000 per year. Few families have savings or insurance to cover these expenses. And public programs like Medicaid face mounting pressure. Workforce crisis, direct care workers, home health aides, nursing assistants, personal care attendants are underpaid and undervalued. Licensing requirements vary by state. Career ladders are limited and turnover is high. Without systematic reform, the shortage of caregivers will worsen as demand rises. Funding shortfalls. Medicare, hospital insurance, and Social Security retirement benefits face looming defects. Without intervention, these programs may be unable to sustain the growing needs of older adults. Policy and system implications. Current levers. States are experimenting with Medicaid 1115 waivers to extend home and community-based services. Medicare advantages, inclusion of social supports is a step toward holistic care. Needed reforms. Experts call for restructuring pay and licensing to professionalize caregiving, creating a federal catastrophic long-term care insurance program to protect families from financial ruin and addressing the sovereignties of Medicare and Social Security equity concerns. The article stresses that aging is not experienced equality. Low income, rural, and minority populations face disproportionate barriers to accessing quality care, underscoring the need for culturally responsive and equitable solutions. One sentence takeaway: America's aging population embodies both a success story of extended life expectancy and a looming crisis. While innovations in medicine, technology, and housing offer hope for aging with dignity at home, the nation must confront soaring costs, workforce shortages, and fragile public programs to avoid a breakdown in long-term care. Here's a clear, grounded explanation of the headline: How Home Care Meets the Needs of an Aging Population, based directly on the content of the page you're viewing. Why home care is becoming essential. The article opens with the demographic reality: by 2050, the U.S. will have 82 million adults over 65, a nearly 50% increase from 2022. Older adults are more likely to live with chronic illness, mobility limitations, and difficulty accessing traditional in-person care. Health systems, both in the U.S. and abroad, are strained with long wait lists and limited outpatient capacity. Home care becomes the logical solution. It brings care to people rather than forcing people to navigate increasingly overburdened systems. How home care is meeting those needs. The page outlines 4 major ways home care is evolving to support older adults: simplifying digital access. Telehealth only works if older adults can actually use it. Many can't due to complex logins, downloads, or confusing interfaces. The article highlights a shift toward one-click virtual visits, no login, no download platforms, passive identity verification, voice or facial recognition for elderly folks. These changes reduce friction and make digital care accessible to people with limited tech skills. Intelligent, personalized reminders. Missed appointments often stem from weather, transportation issues, or confusing instructions. New systems now tailor reminders to patient preferences, including travel time for in person visits. Provide clear virtual visit links and clinician contact. Help patients set up their own notification routines. This supports adherence while preserving autonomy. Designing for accessibility, not just efficiency. Older adults may have hearing, vision, or cognitive impairments. The article emphasizes tools such as voice-enabled interfaces that narrates on-screen content, AI-powered hearing aids that adapt in real time, large font, audio-supported interfaces, digital orientation, support for people new to technology. These features reduce frustration and help seniors engage meaningfully with their care. The rise of intelligent care pathways. This this is the most forward-looking part of the article. Home care is evolving into integrated AI-supported care pathways that combine triage, appointment supports, reminders, accessibility tools, administrative automation. The article notes that automating administrative tasks can save clinicians 70 minutes per patient. Improving both efficiency and data quality. The core message: home care is no longer just care at a distance. It's becoming care that meets people where they are. Technology, technicalities, connectivity, and emotionally. The article argues that if we want older adults to age safely and confidently at home, the tools must adapt to them, not the other way around. Okay, guys, that's your shows for tonight. I will see everybody sometime tomorrow for shows or Monday, depending if I want to jump on or not. I'll see what I can do about trying to do 1 or 2 shows tomorrow. For now, Gator Wellness, take care, folks.